When I was 6 years old, that's when the pain started worsening in my knees, and my mom and the providers there thought it was just growing pains. We noticed a dramatic change in my health. I was diagnosed with juvenile rheumatoid arthritis.
Maniluk Association is the health and social services and tribal government services for the Northwest Arctic region. We serve about 8,000 residents here in Northwest Alaska.
Our service area is about the size of the state of Illinois, and half the people in the service area live here in Kotzebue, and the other half live out in the outlying villages. There's no roads that connect our villages, so all transportation is by light aircraft, or that's the main commercial means of transportation. Summertime, people boat up and down the rivers and on the coast, and wintertime they use snow machines to get back and forth. But the closest village is 65 air miles away, and the farthest is probably over 200 miles away.
So this sometimes can be a resource-limited area. You have to find out sort of how sick your patient is, and then you have to take into account where you are and how long it might take to get the patient to a higher level of care. So sometimes that can depend on what the weather's going to do, the weather forecast, just availability of pilots, planes. It adds another dimension to managing the care of your patients that you wouldn't necessarily have in the lower 48, where there's a road system and nearby cities.
The way our healthcare system is arranged is really in 3 tiers. We have the village clinics, which are primarily staffed by community health practitioners, and then people who need care beyond what their scope of work will allow them to provide come here to the health center, and then folks who need secondary or tertiary care would go down to Anchorage to A&MC.
I was traveling every 3 months to Anchorage. I had to take more reading classes and math classes, extra tutoring, because I was missing school, because we were gone at least 3 to 4 days. So that's an entire week of school. Back then we only had Monday through Thursday, so I literally missed a whole week.
Access to care is a big issue because it's very expensive for a village patient, for instance, who needs a higher level of care to travel to Kotzebue or Anchorage. Certainly the way that our system has developed now, we're able to get at some of that challenge primarily through using the electronic health record and a number of other telehealth applications.
So I have a patient that comes in for a toothache. We take an x-ray, which once the x-ray is taken, I take a look at it first and decide what to do, what's the best option. So we do a radio call. The doc's able to pull all the information up right there once they see that a radio call is put in the computer. So they're able to see the x-ray and help me to determine what the best treatment would be.
Broadband internet is vital to the way that we live up here. This day and age, everyone is connected, and the Maniluk Association uses the internet and WAN connections between Kotzebue and the villages to provide health services. Having the same access to the internet and network services out in the village is it's life-changing.
So there aren't very many providers out here in the region. So they usually have providers scheduled out to the different villages. I'm not sure how often, but could be several months. And by the time a provider gets there, then it's usually too late and the teeth have to be extracted. I do fillings pretty much every day, so it's nice for me to be here and provide fillings and exams, cleanings, and it's offered right here in the village, so that's what makes it convenient for the people in Noorvik.
I think Maniilaq has leveraged the technology and the networks available to improve the level of service, similar to what you might see in the lower 48 or on the road system in Alaska. You can see a variety of providers without leaving your village.
I never had to travel to Anchorage anymore. It's not because I'm in remission, it's just because my provider, my Anchorage provider, anytime that I want to talk to her or see her or speak to her about my condition, and we would do a VTC, and it's a video teleconference appointment, and all I would do is just go to specialty clinic, and the nurse, it's just like a normal, regular visit.
The network connectivity in a remote clinic is game-changing for providing services out there.
You know, one of the things that we're proud of is meeting all of our clinical quality indicators, or exceeding national goals for the last 3 years. It's something that we continually strive to improve.
We still have our challenges. Right now we have land-based connectivity to about half of our villages in the service area, and we'd really like to see the expansion of that, of the terrestrial-based networks to all of the villages, to bring the same level of service up to the standard that we have now.
That's the first thing I'd ask, is understand and consider that the federal government has a federal trust responsibility to provide the resources for us to deliver health care here in Northwest Alaska to the people that we do, Nupek Eskimo people. If you're not familiar with rural Alaska, whether it's Kotzebue or our villages, or pick any other place in rural Alaska that face the same challenges, come visit. Understand the challenges for yourself in terms of the distances, the remoteness. And then the third thing I guess I'd ask is that, you know, that there be look at creative ways for addressing the USAC cap. I mean, it's my understanding that the cap wasn't done by statutory authority. If that's truly the case, then there should be ways to get more funding into that vital program that serves not just the Maniilaq Association in our region, but every other rural region in Alaska.
You know, Noorvik is fortunate to have providers here. Not every village has so many providers, and I'm just very thankful to be able to provide services.
I think it's a huge impact, a huge positive impact on this small community.
Information technology, IT, has allowed us to do things that were just not possible. We're trying to build IT capacity for the specific purpose of improving healthcare and improving people's lives, but at the same time, you're providing access to a whole broad array of other information capacity in all sorts of different levels, whether it's the school or people's homes or the community.
I'm going to school to become a nurse. In the future, after school is all done, I want to come here to work at Maniilaq for our people.